In the United States, some health insurance is funded publicly, meaning funded by the government. Two primary publicly funded insurance programs are Medicare and Medicaid. In existence since 1965, these programs represent roughly 1/4 of the country's annual budget and have significant impacts on the United States healthcare system. Medicaid is discussed in a separate lesson. Here, we'll discuss Medicare. The federal government operates the Medicare program. Specifically, Medicare is administered by an agency within the Department of Health and Human Services, called the Centers for Medicare and Medicaid Services, or CMS. Let's start with Medicare eligibility. Although Medicare originally applied only to individuals over the age of 65, the program was later expanded to cover some individuals with disabilities. Currently, United States citizens and lawful residents are automatically eligible for Medicare if they're over age 65 and have paid Social Security taxes for at least 40 calendar quarters, or 10 years. This eligibility applies even if the person is still working or has other income. For instance, if a citizen was 65 years old, had worked for 30 years, had paid Social Security payroll taxes all 30 years, and was still working, then the citizen would be eligible for Medicare. Some spouses and former spouses of eligible individuals are also eligible even if the spouse never worked. And some federal retirees are eligible regardless of age. Disabled individuals may be eligible for Medicare if they qualify for Social Security or federal railroad retirement benefits, have end-stage renal disease, or have ALS, also known as Lou Gehrig's disease.